Welcome to Babies Matter Medical Center. We're a new advanced neonatal care center based in Lekki in Lagos. We specialize in premature babies. We go down as low as 25 weeks, although at the moment we have one that's actually 24 weeks. We have all the equipment that's required to look after these babies. It's a difficult time both for the babies and for the parents. A lot of challenges, but it's a job Joseko and I both love to do. We actually have a baby on a ventilator at the moment. He's a 24-weeker. He was sent to us. Mom was sent to us when she was about 23 plus weeks. And the baby was born at 24 weeks. So, as you know, that's very, very early. That's almost 4 months early. So he has ended up on a ventilator. A ventilator basically takes over the breathing completely for the child. So he doesn't need to make any effort by himself. The ventilator does all the work for him. Okay. So any baby on a ventilator is quite critical. They're quite unwell. So we just he's stable at the moment. So we'll just just do what we need to do with him, really. So that's a ventilator. We also have a machine called the CPAP machine. A CPAP machine, sort of, the baby has to breathe for themselves, but the CPAP just helps with a bit of pressure and oxygen, opens up the lungs for them, so they don't have to make much effort when they're breathing. Many premature babies need this, because when they're born, their lungs are immature. They can't expand their lungs properly. Because what they need to expand their lungs properly is not, there's not enough of it in the lungs because they were born too early. So what this does, it gives positive pressure and it opens up the airways for them, so it makes it easier for them to breathe, and you can also give some oxygen delivery at the same time as well. It's a very good machine. A lot of them, and he's over a month old now. He's just a perfect 25-weeker. Again, that's almost 4 months early, you can imagine. He didn't really give us much trouble. He's done very, very well, very, very well. He's gaining weight nicely now. And if you come around to this side, here we have a 27-weeker. Again, she's done very well. She's only needing a little bit of oxygen now. Again, she also had CPAP. They both had CPAP when they were born. But she's doing very well. She's gaining weight nicely. So she just needs to be a certain weight, and then we can take her out of this. It's always an exciting day for the mothers. We surprise them. They come in and they just see the babies out of the incubator. They dance, they pray, So we're just waiting for her to gain enough weight to come out of the incubator, both of them actually. But they're doing very well. And then this is one of our triplets, the 30-weekers I mentioned. Again, you can see she wasn't in an incubator. She's now out in a cot. Again, mom very excited. Doing very well. This is a overhead radiant warmer. It's called a resuscitator, where it controls, we put what temperature we want the baby to be, and it controls the baby's temperature for us. And then this is a monitor, multi-parameter monitor. Does the heart rate, respirations, oxygen saturations, and blood pressure. So full, multi-parameter monitoring, really. So how long baby will be on the ventilator, difficult to say. He's stable at the moment, but we'll see how it goes. Okay. And this is one of the phototherapy machines over here that's used to treat jaundice. Yes. But there are different types. This is just one type. There are other types as well we have in the store, and it's just used to treat jaundice that lots of these premature babies have. Okay. This is the Neonatal I was talking about. This is what we use to do our resuscitations in the theater or in the labor ward. Because many of these premature babies come out and their breathing effort is not adequate, so they need some help quickly. So this is connected to an oxygen cylinder, and we can give breaths quickly with this. This has saved a lot of babies. And of course, we have the infusion pumps to give them the IV fluids. We have the syringe pump drivers to give medications. So really, whatever equipment is needed for neonatology, we stock everything here.
We both have a deep passion for trying to prevent unnecessary deaths, there's preventable deaths within the preterm population. And it's based on that we started this company. As soon as the idea crystallized, we created training models, particularly for the nurses and also doctors. But because the nurses are 24/7 with these babies, they need to understand everything about the care, the why, the how, and what they are doing. So training was created, the training model was created before they started work, and it has been ongoing with constant monitoring, mentoring, and encouragement of the staff, because they have to be trained on how to look after the patients, how to diagnose problems so that they can quickly get there. They have to know how to prevent problems. They have to know how to share communication within themselves and within the doctors and within the consultants. They have to know how to engage, communicate, console the very worried parents. We have reached a reasonable state and a reasonable state of capacity, and we're even planning to increase the number of beds. We have 10 beds, but to increase it to 20 beds. So this is the time now to reach out to the IVF doctors, because there's a higher percentage of preterm babies with IVF conception, most of them being multiple. We need to reach out to the O&G doctors, to the general practice, comprehensive, second-tier hospitals that do deliveries, because we have found that the earlier the babies get to the unit, the better the outcome. And we are even advocating to our O&G colleagues that if it is possible, if there's time, they should come here, do the delivery here, collect their fees, and then hand the babies over to us. By 2 minutes, the babies should be in the unit, so that before the body starts crumbling down because of the immaturity, particularly the lungs, the baby is already attached to technology and is with hands that can understand the workings of a preterm baby. So we're working very hard now, because we have to change the narrative. We have to make sure that these babies live, because we've got so many, between the outreach group, the Babies Matter group, we've looked after over 600 preterm babies. So we are proving a point that these babies can live.